already it is 8:56.
Okay, good evening, everyone. Congratulations to all of you for our first anniversary Academy of Pain Physiatrists. So on this occasion, we have organized a quiz. So before starting a quiz, I would like to read some rules. Join the meeting with your original name, and all questions will be in objective multiple choice format. A total 15 questions will be asked, and camera must be on and mic on mute mode. And all questions will be based on pain medicine and rehabilitation in pain management. And the first correct answer submitted in the chat box will be considered final. Your first response will be considered final, and subsequent responses for the same question from the same participant will not be considered. And questions will not be shown again, so answer promptly. And there is no negative marking for incorrect answers. Prize money is exclusively for APP members, and the top 3 participants will receive a certificate of appreciation along with the prize money. In case of the tie, the prize money will be equally split among the tied participants, and APP council member are not eligible to participate or win prize. And if you have any doubts or queries, please ask after the quiz completed. So let's begin with the quiz.
And we will give 30 seconds for each question. 30 seconds.
And mic video must be on for all participants. So here's the first question. Rambir?
I think 30 seconds are over, I think.
Stop, please stop. I might see.
Change the question.
रुक जाओ अभी 1 सेकंड में नेम ऐड कर लेता हूँ.
नहीं, you should change the question in all 30 seconds.
Dr. Minaj, you can discuss the.
Yeah, actually my screen is paused. Wait a minute. There's some technical issue. The answer of the first question is CRPS 1. The symptoms described severe pain disproportional to injury, skin color changes, and increased sensitivity in the affected limb are typical of CRPS type 1. Now, next question is Rambir, please start the timer.
Yeah, I've started. Stop.
So answer is C. The patient presents with the symptoms suggestive fibromyalgia, and regular physical activity and exercise therapy are cornerstone of the treatment and help improve pain. Medications like duloxetine and SNRI or pregabalin are typically preferred. NSAID are not effective in managing the central pain, and opioids are generally contraindicated. Now, next question is.
रुको 1 मिनट रुको, मैं एक बार ऐड कर लेता हूँ.
So I'm also doing that. Rampik, I'm also doing that.
Okay, okay. नेक्स्ट क्वेश्चन करो.
The answer is A. The contrast is not routinely needed for evaluating axial low back pain or a degenerative disc disease unless there is a suspicion of infection, tumor, or prior spine injury. Next question is
थर्ड क्वेश्चन था नहीं.
हाँ, yes, yes,
अभी फोर्थ पे आ रहे हो तुम.
yes, yes.
yes, fourth question.
और बोल के आए हो, है ना, बोल के आओ. जैसे फोर्थ पे आने वाले हो तो ताकि मैं उसको रिसेट कर लूँ अलार्म को ना.
Question number 4.
स्टॉप.
The answer is traversing route. You can see in the image. Both are showing in traversing route and exiting nerve route. Now, next question is fifth.
स्टॉप.
The answer is A. The child has history of the sudden onset severe neck or upper back pain, likely indicating structural or pathological issue. Imaging MRI and X-ray with flexion extension is required to assess structure abnormalities or any soft tissue pathology. Vitamin D supplementation can be given, but muscle relaxant or exercise could mask symptoms and potentially worsen structural damage. An investigation like ESR, CRP, vitamin D3, these are secondary tests to evaluate inflammatory or metabolic cause. Now, next question is sixth question. Question number 6.
स्टॉप.
The correct answer is A, posterior MI of C2. Now, next question. Question number 7.
Very fast answering by all of the participants.
यस सर, इट्स वेरी डिफिकल्ट टू रिकॉर्ड. सर आप रिकॉर्ड करते रहिए, मैं टाइमर देख रहा हूँ बस.
मैं बेस्ट पॉसिबल कर रहा हूँ, बट एक्चुअली बहुत फास्ट हो रहा है सब कुछ. ठीक है.
स्टॉप.
Okay. The correct answer is D. Cyclobenzapine is a centrally acting muscle relaxant, structure related to tricyclic antidepressant. Now, coming to the next question. Question number 8. It's very tricky question.
स्टॉप.
The correct answer is C. You can see the dose conversion the elimination time of the methadone can be administered safely in the CKD patient. Why? Answer is not fentanyl, because 12.5, according to patient pain score, 12.5 is not adequate for the pain control, and methadone is safe in the renal kidney disease patient. So the answer is the methadone. Now next question. Question number
Question
nine.
number 9. Question number 9. Stop.
Okay. So answer is E. This is the American Society of Pain and Neuroscience best practice and guideline for the interventional pain management. The article we have shared in the group. So all are correct according to this guideline. Now next question is
Number 10.
question number 10.
Stop.
The correct answer is A. The foramen ovale is located within the sphenoid bone and contains the mandibular branch of the trigeminal nerve. Now coming to the next question. Question number 11.
Stop.
Okay, the correct answer is KVP. Kilo voltage peak is a difference in voltage between the cathode and anode in the X-ray tube, and the higher the KVP penetrate will increase the expense of the resolution. So coming to the next question.
Question number 12.
Question number 12.
Stop.
The correct answer is none of the above. The patient symptom correlate with the tension type headaches, and which is characterized by the option A, nausea and vomiting, pulsating quality behind the eye unilaterally, and see flashing lights. The onset are not typically tension type headache. And option D is excessive lacrimation is associated with the cluster type headache. So coming to the next question,
Question number 13.
identify the test. Question number 13.
Stop.
The correct answer is D. It's a Spalding test, not spring test, and which is also called foraminal compression test, neck compression test, or quadrant test. Coming to the next question. Question number 14.
Stop.
So correct answer of this question is C. The symptom aligned with the C5 radiculopathy, weakness in shoulder abduction, extension, and flexion, and absent bicep reflex, sensory loss in the lateral forearm. And coming to the last question, question number 15.
Stop.
The answer is B. Stimulation site to the spinal cord stimulation, or you can see in the text, and the answer is, according to question, is answer is B. Okay, thank you very much. Now I would like to call Dr. Nitesh sir. Please speak about Academy of Pain Physiatrists, how the last 1 year. Nitesh sir, over to you. Sir.
Actually, I'm really glad. Basically, the most of the even our super seniors also participated into the questions. This question quiz, basically question answer quiz, and even the young physiatrists also, they are actively participating. So I think we are on the right track. Till now, actually, it is today is the completion of 1 year of Academy of Pain Physiatrists. We started just like, I think there were at 15 to 20 members only initially. And now we have reached near about 150 members within a short period of time. So I'm actually happy to inform that till now we have conducted basically, including the today's workshop webinar, 9 webinars, out of which basically 4 webinars we included the international faculties, and 5 webinars from the national faculties, and 2 journal club, and there was a 1 case-based discussion also. And I think in the November or December, basically, we conducted our first cadaver ultrasound guided workshops in the KGM. I'm very much thankful to the Anil Gupta sir and Sudhir Mishra sir for their great support to conduct our first workshop with the great success. Basically, even we could not expected that this our first workshop will be great success for and inspiration for all of us to go for our next workshop. So we are planning to conduct our next workshop at AIMS Nagpur, which will be focused on the spinal plane. And we'll conduct the fluoro-guided pain workshops. We'll try to include the basics to advance, and already the scientific program has been made, which will include the basic lectures, then a few like panel discussion, case-based presentations also, and we'll focus more on to give the more of hands-on work, on cadaveric hands-on work. So we'll able to make our young physiatrists to expertise. I think most of our young physiatrists are not working on the fluoroscope. So we'll make them basically trained on the fluoro-guided intervention in the spinal pain. I think we have conducted our first webinar, which was our opening ceremony workshop which was conducted by the Dr. Andrea Furlan from Canada. She is now professor there. And then we are trying to include the topic, which is area of interest of all of our physiatrists. Then next webinar was taken by our young dynamic faculty, Dr. Rambir, how to present basically journal club. Third was our online journal club. Okay, there we had basically 2 different types of journal club article we have selected last time. I'm remembering, I think one was it was like pulsed RFA of cervical roots. Okay, and fourth webinar was conducted by the Professor Iriagne from the Spain, which was, I think, really excellent. Webinar was taken on the subgluteal syndrome. Fifth was by Navita ma'am, how to approach the pelvic pain, basically, which is again the mostly ignored part by most of us, how to diagnose the pelvic pain. And after that, we keep the panel discussion on the CRPS. Again, these are the common conditions which come across in our OPD. So how to manage CRPS, that is also important. After that, there was excellent presentation by Dr. Dhruv Bibra. So we try to include the multi-speciality in our this platform. Not only focused on the physiatrists, we'll try to include those are the really excellent people and those are really doing the good jobs. We'll try to include them also so we can share the knowledge and it will provide the good opportunity for our new research also. Then we had one of the important topic of spasticity in physiatrist point of view. So we kept the webinar on the cryoneurolysis of different nerve, basically peripheral nerve. So we can use for the management of the even pain and spasticity. After that, again, there was a topic on the pelvic pain assessment that was taken by the Professor Ravi Shankaran sir, which is it was one of the great presentation. And so we can aware the people about the pelvic pain assessment also. Last time, I think one of the workshop was presented on the role of physiatrist in pain medicine and how we can provide the different, how we can assess the different opportunities for the physiatrist so we can excel in the pain medicine. And after that, I think it was taken by the Dr. Sanjeev, how to run the pain clinic, which is again very important because there are the very less number of physiatrists who works in the private practice. So it was a good lecture and a good initiative by Dr. Sanjeev. So he can basically motivate the other young physiatrists, so those who can involve in the private practice. And last was today's webinar, which was taken by the Dr. Naman Goel sir. So it was really excellent presentation. So now we can open our eyes how we can diagnose the different types of spinal pain. He was also more focused on how to diagnose the spinal pain and pain generators, which is very important. And again, try to basically improvise ourselves, how we can put down the diagnosis instead of writing the lumbago or lumbar pain. So we try to make it more focus on diagnostic part also. So that's what the list of basically our academic activities. Basically, it was our collaborative work done by our scientific committee also, and all members which are basically involved in the making the program successful. So for new year, we'll continue all these activities and try to improvise our academic and research part also, and we'll try to keep the basic topic which is important for in our OPD and IPD patients also. So this was from my side. I think there is a time to announce the winner also.
Dr. S. sir will announce the result.
Yeah. Yes, sir. Dr. S. Ladar sir will announce the results for today's webinar quiz. Dr. Yadav sir.
Yes, I am there. I am hearing you.
So,
So we have shared the result in the group. You can see the in the group.
Executive Council group, WhatsApp group, sir.
Just a minute. I'm not able to see the result yet.
Sir, Executive Council. ग्रुप में.
Like which has been sent by Dr. Sanjeev Sharma, right?
Yes, sir. Yes, sir. And later on by Dr. Minhas, you can see, sir. First prize, there's a tie on the second prize actually. So first prize you can announce.
Like Minaj has shared already, like I congratulate all the winners. I think the first prize goes to Dr. Utkarsh.
Yes, sir. Dr. Utkarsh.
That's right, I believe.
Yes, sir. Yes, sir. Dr. Utkarsh. Rupees
And for
2,500.
second prize, there's a tie between Dr. Anil and Dr. Ganesh. So it goes 1,250 to each.
Yes,
Is
sir.
that right?
Yes, sir.
Yes.
Yes, sir. Yes, sir.
Okay. So and how about the third prize?
So actually that has been tied, na, so the prize has been divided.
Okay.
Total price has been divided between the two.
That's all, or
Yes, sir.
the-
Yes, sir. Yes, sir. Yes, sir, sir.
Thank
all
you.
right.
So
Congratulations to all winners.
Congratulations to all winners, and I would like to say most of the participants have answered the right answers also, but later on, but they were not the first finger first. So the only the first correct answers were taken in account. So congratulations, Dr. Utkarsh, Dr. Anil Gupta sir, and Dr. Ganesh Yadav. So I think we can have some closing remarks.
This is all of them from the PGMO. They
Dr.
have done good
Sanjeev,
job.
Dr. Sanjeev, you can pass on my prize money to any junior person. I was just
Great, sir.
participating as a participant. Okay.
Sir, whoever you choose, sir.
आप नेक्स्ट जूनियर को चूज कर लो, या जो जिसके साथ टाई हो रहा है उसको आप दे दीजिए. No issue.
ठीक है सर.
Okay, sir.
It
Okay,
is good,
sir.
sir. But आप एक्चुअली केजी में भी ज्यादा पढ़ा रहे, मुझे लग रहा है सर ऐसा. ये सारे KG में
No, actually, नितेश की स्टूडेंट आराधना इज विद अस. पहले से
हाँ,
वो
ऐसा
काम कर रहे हैं.
ऐसा कुछ नहीं.
अच्छा, Dr. Utkarsh is on video. So Dr. Utkarsh, please speak something about you and congratulations, Dr. Utkarsh.
Thank you, sir. Sir, I am very thankful to faculty here in KGMU, Gupta sir, Aradhana ma'am, Ganesh sir, Sudhir sir, and all other faculties. I am a third year resident. I have just now given my exam for third year PG
Great,
in
great,
GMR.
great. Third year PG. Great.
Yes, sir.
Again, it is inspiration for all of us. We can again excel ourselves in the area.
Great,
Yes,
great.
thank you.
You try to join in the AIMS Nagpur spinal pain workshop.
Yes, sir. Sure, sir.
Dr. Ganesh.
Sanjeev, I congratulate you all, like, because the very well conducted
Yeah.
the topic on bacteriogenic pain, and that was excellent. And I had also learned out of it, like, because most of the time we tend to forget about this entity, which is very essential to know and like how it could be treated. Though things are very ambiguous between, and there is a narrow thing, like whether it's bacteriogenic pain or whether it's from the discogenic pain. But nevertheless, like, because you guys are doing a lot of, ablation work, so probably over the period of time that others would also learn and they could manage better such kind of entities, in the future. And second thing, a lot of discussion was on that, like if there is some infection, other things. So I think in that case, as far as my view is concerned, like we need to correlate the like what all lab investigations to be done, what are the symptomatology, and what is the findings in the MR. Because in the MR, if we think that it's like infective discitis, then possibly there will be some abscess formation. So how we can exclude those kind of things, like, so, but there is a very narrow margin. So detailed history, clinical evaluation, the lab tests, they are very important to clinch the right diagnosis and to put a right management for such patients. That's all from my side.
Thank you, sir. Thank you, sir. So I think closing remarks by Dr. Nitesh or Dr. Satyashil. Dr. Satyashil is there.
Actually, this quiz was very good. Even it was a learning also. Explanation given by Dr. Meena Nadit was really good. Simple questions,
Thank you, sir.
simple, sober, and good explanation.
Thank you, sir.
I think today was a good class. I think near about 90 participants have joined today. It was good.
Can I say something? This is Naman here.
Yeah.
Yes, sir. Yes. Oh, okay, sir. Hello, sir. Hello, sir.
My closing remarks. But yeah, I mean, it's a wonderful platform. I mean, I'm glad that I'm here. The quiz was awesome. The questions were great, and the explanation was wonderful. So it's wonderful experience being here. I would like to participate in this activity every month now onwards, if possible.
Yes, sir. Definitely,
And
sir.
Dr. Anil Sir's junior is me, so I should get his money.
Great.
Sure,
Thank
sure.
you.
Of course, Naman, it was a nice presentation by you, and I'm very happy to see you. Actually,
This is the first time Anil sir is praising me, by the way, on record.
no, I always praise you.
Naman, you always been praised by everyone. No?
Yes,
Don't
sir.
say that.
Naman,
Anil sir, love you and
hello.
nice to connect with you, but I'll be here every month now. Thank you.
Thank you.
Great.
Thank
Hello.
you, sir.
So good to
Naman
see
sir,
you
one request to
again.
you. Hello.
Okay.
Yes.
Yes, sir.
Naman sir, are you there?
Yes.
One request to you. You
Yes.
can motivate our residents from the US also, those who are working
Yeah.
with you.
Sure, absolutely.
So
And
to-
like I said,
well-
I will have one of my actually junior from my residency program in USA. He actually opened a practice in Mumbai.
Okay.
It's more or less like interventional, like he starting a practice there, but he wants to get involved in regenerative medicine. So I will ask him to deliver a lecture. I'll connect you to him,
Yes, sir.
and he will deliver a lecture on regenerative orthopedics.
If
So
these
I'll
possibilities are there to conduct the collaborative research with Indian
Yeah.
Institute or USA, then you can guide us.
yes, and he'll be more than happy to do some kind of workshops also in
Yeah.
India.
Yeah,
So
sure,
he
sir.
can-
Sure.
Yes, and
Sure.
I will be more than happy to do what I can. But yes, I will
Even
do my
we'll be happy if you become our member. NRI